Welcome everyone to our webinar, Better Strength, Better Balance, Partnering to Deliver a Fall Prevention Program for Older Adults, facilitated by the Fall Prevention Community of Practice. My name is Mariel Ang, and I am the Project Coordinator at the Ontario Neurotrauma Foundation. ONF sponsors the Fall Prevention Community of Practice and its online platform called Loop. Loop is a place where fall prevention practitioners connect. Visit us at www.fallsloop.com. Marguerite Thomas also joins us on the line. Marguerite is the liaison for the Fall Prevention Community of Practice. She will be assisting with facilitating questions in the chat box today. Before we begin, I'm going to give you a quick rundown on the Level 3 meeting system. This webinar technology consists of two parts. The audio is provided through a telephone conference line, and the visuals are provided through a web platform. The phone number for the conference line and the link to the web platform were sent to you by email after you registered for the webinar through Level 3. If you have questions about the technology at any time during this presentation, please type them into the chat box on the left-hand side of your screen. Alternatively, you can email me at Mariel, that's M-A-R-I-E-L, @onf.org. I will work with you to resolve technical issues as soon as possible. This webinar will contain opportunities for participation. There will be online polls throughout the presentation, which you will answer directly on your screen, a video with audio available through your computer speakers, and a question and answer period at the end. If you have topic-related questions during the presentation, please type them into the chat box. During the Q&A, questions will be read aloud to the group. If you would prefer to ask your question over the phone, we will provide the instructions to unmute your line during the Q&A. The webinar is being recorded, and a YouTube link will be sent to all participants in about 1 week along with the presentation slides. I would now like to introduce our presenters, Kelly and Darcy. Kelly McKay is the Quality and Change Management Officer for Ottawa Public Health. Prior to this role, she was the Evaluation Officer for OPH's Health Promotion Service Area, providing consultation and support to ongoing evaluation activities. She has a background in nursing and recently completed her diploma in program evaluation. Darcy Tang is a family health specialist from Ottawa Public Health with 18 years of experience in public health. She has a Master's of Nursing degree. As an advanced practice nurse, she works with a multidisciplinary team providing advice, leadership, education, research, and consultation to public health managers, supervisors, and staff delivering public health programs and services. And without further ado, please take it away, Kelly and Darcy.
Great. Thanks, Marielle. As was mentioned in the introduction, our names are Kelly McKay and Darcy Tang, but I did also want to acknowledge who else was in the room with us to show real partnership. We do have members of Recreation, Culture, Facility Services of the City of Ottawa, Janice Phillips and Leah Champagne. And so I would like to welcome you to our presentation on Better Strength, Better Balance and Partnering for Fall Prevention. And we'll lovingly call this BSBB. Please don't take this as BS, it is BSBB. So in the late 2017, not that long ago, we were able to put forth an article for the Canadian Journal of Public Health that was actually published. And it really outlining our innovative partnership to deliver a fall prevention program. It was prepared with support from the staff of Public Health BSBB team and with the manager of the City of Ottawa Recreation Cultural Facility Services to really outline this innovative partnership. Our presentation today will provide an overview of the article, including the evaluation that was conducted during the early stages of 2014 and 15, and we'll also provide an update as to where we are in current state, both with the program and in partnership. Next slide. So before we get started, we wanted to know who you are. And really, if you can take a moment now to do the audience poll as to what sector you currently work in. And Mariel, let me know when when we have the results? Okay, great. So I can definitely see there is a mix for sure, community care, acute, public health, actually some folks in recreation as well, which is fantastic, some NGOs, some folks from research as well. So really great to see the diversity, and thank you for letting us know who you are. Next slide. So to set the scene for you as to where we were in 2014 when things were initiated, we're probably a similar context that Ottawa, Canada had maybe to your community. And across the different age groups, falls in adults 65 plus were the single highest contributor to hospitalizations. When you kind of put the dollar and cents to that, that's equating to about over $196 million in Ottawa each year, and affecting about 1/5 of older adults who live in private homes. A survey was conducted and really helped to inform us about the physical activity level of our older adults, and finding that for those over the age of 65, less than half were getting the right amount of physical activity, and that 9 out of 10 older adults agree that falls are preventable, but are not taking the necessary steps to prevent them. Probably similar to other municipalities, our population is aging. And in Ottawa, we're expecting that to be about 21% of our population in 2030. Some other unique things that may be or may not be unique to Ottawa was about the commitment for older adults and fall prevention. Specifically, we do have an older adult plan that both the municipal departments of public health and recreation were a part of. Other things that may or may not be unique to Ottawa was about the role of working within our Champlain-Lynn, our local health integration network, whereby there was a fall prevention coalition where we had both frontline as well as managerial staff very much involved in initiatives to prevent falls for those over the age of 65. Next slide. So in 2014, there were some existing Ottawa recreation senior fitness programs that took place. Sorry, next slide. Okay. I'm not sure if we're having difficulties or. Okay.
Mariella, can you hear us?
Yep, I can hear you.
Okay.
I think we're just having the same difficulties as we experienced a little bit earlier. I have the Better Strength, Better Balance slide up.
Okay, so we'll go back to slide 5, and so about the evidence relating to exercise. So we'll go back 2 slides if we can.
There we go.
Perfect.
Thank you.
So there was an existing recreation seniors fitness program that was in place in 2014. And what was thought would be the easiest was to adapt in a current program. And with the adaptations made, we wanted to incorporate some of the best practices. So things like challenging balance and improved strength through resistance training and exercise in standing position. Being able to tailor, we do have certified senior fitness instructors who are able to make sure it's the right level, understanding the individuals if they've had fall risks, medications, that kind of thing. The other key piece is that the evidence about the number of times per week to provide exercise. And so it was offered, the evidence is saying up to 3 times a week. We were seeing the opportunity 2 times a week that this could be provided. And ultimately, over the time period, it would be progressive. So really starting off at an initial point that is going to be built upon each week. Next slide. So in 2014, Public Health put forth a proposal to funders outlining the goals and objectives of an exercise fall prevention program for community-based older adults. A screening tool was adapted from the Stand-Up program to ensure appropriateness. The goal was to reduce the incidence of falls amongst Ottawa older adults, 65 plus living at home, with some of the objectives to promote regular physical activity and improve strength and balance. increase awareness regarding 6 key behaviors known to reduce the risk of falling, and establish a sustainable new partnership for fall prevention in Ottawa. Next slide. So what is Better Strength, Better Balance, BSBB? It's a beginner-level fall prevention, exercise, and education program for people over the age of 65 who wish to improve their strength and balance. It's funded by the Champlain Local Health Integration Network through Pinecrest Queensway Community Health Centre and is a collaborative effort between Ottawa Public Health, Recreation, Cultural, and Facility Services. BSBB is offered during 3 seasonal sessions, spring, fall, and winter. And in 2014, it was twice a week for up to 12 weeks. As I said, classes were progressive, and participants were encouraged to exercise at home, reviewing some of the exercise with sheets. A variety of simple equipment is used, including beanbags, cones, stretch bands, and balls. Public health staff during that time were responsible for the registration of the program and ensuring the senior fitness instructors from recreation sector had all the key messages that they could be providing during the class. What we're very fortunate about is that our partnerships from previous collaborations were leveraged, and recognizing, as I said earlier, that public health and recreation have similar accountabilities and values related to the prevention of falls and older adult well-being. Both are municipally funded and accountable to residents. Both are seeking equitable service delivery, accessibility, and overall community well-being. Next slide. So at this time, we wanted to showcase the promotion of BSBB that was actually created by some of our students, but out in the communities with the voice of older adults themselves as to what BSBB, Better Strength, Better Balance, is about. Can we play that video now?
Yes, so I'll go ahead and play the video. Please ensure that you play with your computer settings for your computer speakers so that you can hear the audio as well.
The biggest step you can take towards reducing your risk of falling is to get active, and improving your strength and balance is key.
I enjoy teaching the class because it helps to bring a lot of a great relief and changes to other people's life. People have had enormous progress with their lifestyle.
The atmosphere, of course, is very positive. And the teacher is very helpful.
Regular physical activity is important for people of every age, but as we get older, it can be a challenge to find ways to stay active.
I used to walk a lot, and then I got arthritis very bad.
I have had falls in the past, and I find that I haven't had any falls for a while, which is good.
Whether you're already quite active, not active at all, or somewhere in between, we want older adults to know that there are plenty of options in Ottawa to get moving and be active.
Some of the individuals are coming in and shuffling, and now they're actually taking steps, which is absolutely fantastic.
It's helped me with walking. It's helped me to step down off the curb without being terrified.
Just remember, participating in activities that challenge you to improve your strength and balance can make you stronger, more confident, and less likely to fall.
There's this one participant who hasn't been able to take a shower in the last 3 years because he's been afraid of slipping and falling. He came to me the other day, he wrote me a letter, he brought me like a little gift because he was able to take shower for the first time without having that fear.
We're rejuvenated. Yeah, I feel better. I feel better everywhere.
If you're looking for more information about which strength and balance programs in your community might be right for you, you can contact Ottawa Public Health at 613-580-6744.
It's transformed people's life tremendously. For me, it's just overwhelming.
That's great. That's good. Thanks so much, Preston.
So that gives you a bit of a taste. We like the promotional videos because obviously you can hear from older adults themselves as to the impact that it's had. And so we can speak a little bit more as to the evaluation results, but we thought we'd share that with you to begin with. So next slide, I wanted to take a moment to thank our funders, because obviously a lot of what we do, there's a lot of in-kind things that occur both with Recreation, Culture, and Facility Services as well as Ottawa Public Health, but there were some funders who were directly involved as well too. and a local physio center was also involved. We had, as I said, the local health integration network and local community center. And really the agreement that we initiated with was to reach 1,300 older adults each year with about 86 to 130 programs. So that's how things started, and now we'll hand it off to Kelly to sort of give a summary as to where the evaluation took place. Next slide.
So when we set out to commence our journey with BSBB, we knew that because this was a new program, it was really important to evaluate it and choose an evaluation method that would really allow us to improve as we went and really to help shape it for future cycles. I was brought in to help evaluate this, and it's important to note that I wasn't an actual member of the team delivering the program, so I was able to bring some neutrality to the evaluation. We chose to do a formative evaluation. We knew we had a logic model for this program. We knew basically the activities that we wanted to set out to do, but as I mentioned before, we really wanted a quality improvement focus so that we could continue tweaking and improving as we went along. In terms of, we could just switch to the next slide. In terms of our evaluation, we did, just back one, please. We set out to answer through the evaluation, how well was the program delivered, what changes occurred during the program, how many older adults did the program reach, and we also wanted to learn about our partnership between public health and our partners in the recreation sector. Marielle, could you just move the slide back one? Thanks. Some of the data sources that we used to help inform the evaluation was a participant questionnaire with our actual participants, and we sort of had a captive audience in the classes, so we did it in a hard copy format, and we had a 58% response rate from our attendees, so that was really good engagement. We basically used a survey, a Likert scale, asking people about satisfaction and any changes they had noticed in themselves. We also did a series of focus groups, speaking to some of the certified older adult fitness instructors themselves, speaking with our partners, speaking with the team that delivered the program, and this gave us some really rich anecdotal information. We also looked at registration and attendance records because we wanted to see if attendance was stable, if there was fall off, and learn about the kinds of residents who were participating in the program. We also knew that this was a program that was going to be repeated for many cycles, so we really wanted to use each cycle as a baseline for comparison to see if we were actually implementing our improvements and if we were making progress as we went. The other thing we looked at too was just some of the staff time tracking for both ourselves and our partners in recreation so that we could have a sense of some of the resource burden involved with running a program of this scale. So next slide, please. So you'll see here we do have a logic model that was created. It includes the components of the program and the key activities, really focusing on promotion and registration, program delivery, and the partnership itself. So these were things that we really wanted to look at in the evaluation. Some of the activities included the registration itself, that was a huge component of it, instructor training, health promotional materials, and also cross-promotion of other programs within recreation, cultural, and facility services, as well as a use and identification of the recreation venues. The logic model really helped us identify what we wanted to achieve, the related activities, and what success would look like. And we really wanted to focus on demonstrating a link between our intended activities and desired outcomes. Next slide, please. This slide, we just move forward to the next slide. This just delay on the slide, so we'll just hold here for a second. The next slide just basically is a table that summarizes what we were aiming to do. In the far left column, I'm not sure if you can see it yet at your end, we talked about components of effective practice and what we were setting out to do. So we knew that as per our funding and partner commitments, we were aiming to reach 1,300 older adults per year through the program. We knew we wanted to target older adults living at home who were 65 plus and at risk for falls. And we knew that we wanted a program between 2 to 3 times a week over a course of 12 weeks, as per the literature that Darcy mentioned earlier. In terms of our program, you can see in the middle column, we still don't have that slide up, but these definitely will be sent out afterwards. what the intended program set to do, and then what the actual results. So some of the things we found, we were overwhelmed with community response on this program, and registration exceeded our expectations. In the first year alone, we had 2,330 registrants, and we ran 115 programs. We also knew when we surveyed participants in cycle 1 and 2 that 20% of our participants had a fall in the 12 months prior to the program, and that they were community dwelling. And we also looked at some of the attendance to assess adherence or compliance to the program. And what we found was only about 40% in the first 2 cycles attended 75% or more of the classes. This was really significant because one of our assumptions that we made in the evaluation was that participants would have to attend 75% or more of classes to get the intended health benefits. So when we saw the compliance and the attendance, that was definitely something that we wanted to look at and take action. We also noted, too, our intention in the first 2 cycles was to have a fully developed at-home component, and just because of the development and some of the challenges along the way, that wasn't fully implemented at the conclusion of the first 2 cycles. So we're just going to head now to the next slide, highlighting some of the key findings from cycles 1 and 2 of the program. So in terms of our feedback from our participants, and as I mentioned, we had really strong response rates. 98% said they were satisfied. 92% said they learned a new information or skills to prevent falls, and 86% said they were less worried about falling. This stat was quite significant to us because we knew from the literature that fear of falling was has an impact on falls, and was also something that we really wanted to address in the community. Also, 94% felt they had better strength and balance as a result of the program. Now, I must also note these were self-reported. So as part of cycles 1 and 2, there was no observed or actual measured changes noted in participants. We didn't have that scope of an evaluation. Next slide, please. So moving on to the next slide, some other key findings that we had was that 98% of our participants intended to continue exercising after the program. At that point, there was no follow-up to assess if they actually did, but we felt that this intent was a really important first step. 73% would adopt at least one or more new fall prevention behaviors. And what really struck out was the amount of anecdotal comments and testimonials that we received from participants. In our survey, we had just an open-ended question for comments or for any feedback that they wanted to provide, and we received hundreds of stories and responses. We weren't expecting this range of feedback, but theming it and looking at it also gave us some really rich information. And one of the things we know, too, from the evaluation community is that these narratives and personal stories have a lot of value and merit, and often more impact than numbers would. So the next slide that we'll move to will just show you some of the feedback that we received from participants. And there were many in this genre, remarkable improvements. Folks who said they'd had a bad fall and that the course is now helping with their fear of falling. Next slide. So there are some more comments here you'll see on the second slide. One I just wanted to highlight, this program helped me through the grieving process after my husband died. So some of the themes that we really saw, a lot around comments around reduced fear of falling, but we started also to hear a story around how this program was also addressing things like isolation, supporting through grief, mental health, social connections were being formed, networks of support were being formed. People were identifying and feeling a sense of belonging. So definitely when we set out to do this program, these weren't necessarily our intended benefits, but we were absolutely thrilled to see some of these themes, and they certainly warrant further investigation in a program such as this, which we'll talk about a little bit later. Next slide. Some of the other key findings were from our instructors themselves. We were really fortunate through our partnership with Recreation to have access to some uniquely trained and skilled senior fitness instructors, and they were instrumental to the success and development of this program. So if you go to the next slide with key findings, you'll see from our instructors, we did ask them about some of their observed change. As I mentioned, there were no measured changes that actually done with the participants, but our instructors 100% felt that they had noticed an improvement in their participants, and 85% got the support needed from partners. So that the support from partners was something we really wanted to look at because we realized that our instructors were our front line and they really were the key determinants of success of this program. So we wanted to make sure that they had the information, training, tools that they needed to provide the service. We also, as I mentioned earlier, did focus groups with some of the participants, and this information really helped shape future cycles of the program. So they were actively engaged in the planning and improvement as this program evolved. Just some other key findings you'll see on the slide there specific to partnership. We really wanted to look at this and learn about this. So through some focus groups and feedback from our partners, we heard that we had good communication between our frontline staff. It was very important. There was lots of partnership and teamwork and collaboration. One thing that came out very well with the benefit of this was access to the huge network of venues and infrastructure through recreation cultural facility services. I know in the world that many of you work in terms of fall prevention. This can be a challenge or a stumbling block for many programs, but municipal recreation has a natural network of well-equipped sites. And also through recreation, they had the expertise around delivering this kind of program and access to a pool of fully certified senior fitness instructors. We know that both partners as well put significant in-kind contributions, and definitely the leveraging of resources was essential as things went forward. Some of the examples were around when registration exceeded our expectations, our partners in recreation had the class registration system and were able to guide and support us in terms of how to manage this kind of mass registration. And then on the other side, public health, with our background in health promotion, had resources and some of the fall prevention literature that we could help, that we could contribute towards the program. Next slide. We will talk a little bit more about the partnership as we go along, but I did just want to flag on the next slide titled Limitations of the Evaluation. Again, as mentioned, this was our evaluation was based on self-reported data. Certainly, in the scope of this, there was no randomized controlled trial. There's always potential for bias, but certainly provides some really good insight and for some future areas of study. When we set out to do this program, because things evolved so quickly, we didn't necessarily have a standardized class curriculum. Standardization happened as the program evolved. So in the first few cycles, there was some differences between sites in terms of the actual exercise components and how the classes were done. In terms of attendance reporting, after the first cycle, we realized quickly this was something we really needed to monitor. So as we went along, we improved our attendance reporting systems, but in the first cycle or two, there were some challenges. And also, it was obviously very challenging to tabulate our staff time contributed. We did this retrospectively, but really at the end of the day, it provided more of a snapshot of the enormous contributions of both sides. And the other thing too, when we set this up, is we didn't necessarily track repeat versus part-time participants, but as the second cycle or as the program repeated, we also realized that we were getting a lot of participants who wanted to keep coming back, which was a great thing, but as we'll talk about soon, that posed some additional challenges that we had to consider, so starting to monitor that a little bit more closely. So, moving into our next slide, recommendations. So some of the recommendations from the evaluation was really to monitor the attendance at some of our classes going forward. We really needed to look at understanding how many were coming, what were some of those barriers, and really aiming for that 75% adherence to the program. So that was definitely something going forward. We really wanted to look at more sites in the West and East End. So there was some geographic and accessibility things. And really looking at developing an at-home component. We talked more about formalizing the in-service for instructors, and that would lead to standardization so that the same approach and same exercises were being used from site to site. And that also linked to identifying the standard core exercises as well as at-home component. And this was where some of the leadership from our partners in recreation was instrumental. We talked too about reviewing the usage of the PARQ, the Physical Activity Readiness Questionnaire, which I understand is no longer in use. And Darcy's going to speak to some of the evolution in that area. But we really also focused on strategies to sustain this program in the community. Because it was really well received, we wanted to make sure that it could be around for the long haul. And some of the direct activities that did evolve from that further were things like a TV component was eventually developed. And one of the most important things we realized is that BSBB can serve as a bridging program for older adults to other community exercise programs. So we wanted to set up a mechanism where our residents could come into this free introductory level program, but then that they could also continue on to other fall prevention focused or strength focused programs offered by our partners in recreation. So now, before we start talking a little bit about some of our unique learnings and findings from the evaluation around our partnership, we just wanted to learn a little bit more about all of everyone listening in today. So we're going to go to an audience poll, and just wondering if you can indicate, has your organization ever partnered with municipal recreation providers?
And I guess if you're from recreation, you can put that as public health. Interpret that as public health.
Yes, good point. Great. Great. So as you can see there, over 70% have. So this is really exciting. So hopefully some of what we're saying will validate the work you've done or possibly pose some new ideas. So now going forward, we want to start to focus on some of the lessons learned from working with our municipal parks and recreation providers that hopefully can inform opportunities for everyone listening in going into the future. So we're just going to move forward. I see we have the recommendation slide. We're going to move forward to the partnership lessons learned slide. There is a lull between I believe the slide's moving and what is displayed, so we'll just give it a second there.
Yeah, Darcy and Callie, this is Mariel speaking. I believe that's only happening, unfortunately, for your slides. We've had some participants comment that they are seeing the correct slide, so just continue on with your notes. Okay,
thanks. My apologies, everyone. So just some of the lessons that we learned through partnerships. Public health and municipal recreation working together was beneficial because both partners are well established in the community and therefore could leverage and maximize each of their existing partnerships and resources. So we were able to double our reach of existing channels and partners. We were able to leverage specific resources around venues, class registration systems, equipment, promotional opportunities, for example, the recreation guides, as well as funding opportunities. One of the things we both shared a mandate around accessibility, our partners in recreation do have a subsidy program called Hand in Hand that does provide subsidies for individuals who could not carry on and cover the cost for additional fitness programming. Both partners had strong reputations in the community and also a network of fall prevention resources. And we had public health nurses within public health who had a strong background in health promotion in this area. In most communities, so not just in Ottawa, municipal recreation has unparalleled access to infrastructure and resources. So obviously, too, the instructor base and these instructors spoke many languages and the venues across the city. We did talk a little bit about as well, public health bringing to the table some of the epi data that we have access to, and also findings from a recent Ottawa neighborhood study. So we brought some unique strengths and information to help inform the program. The other thing that was really important was around our shared accountabilities and values. Both of our organizations are housed within the municipality of the City of Ottawa. We're both tax funded. We're both accountable to our municipal government. We're both contributing towards a municipal older adult plan for the city. And we also had focused on addressing social determinants of health and very similar practices around information and privacy and accessibility. As I mentioned earlier, Parks and Recreation, the program at the time, had access to subsidy programs if needed. Both partners operated in both official languages, and we operated under the same accessibility of Ontario's with the Disabilities Act. Ottawa Public Health is a trusted source of health information, so well positioned to promote recreation programs. And recreation is a recognized service provider and a trusted service provider, so well positioned to promote public health messages. So we felt that our complementary approaches really set us both up for success. And as well, we both had a stable community presence, offering services for many, many years. Next slide. So just in terms of some of the other lessons learned, some of the challenges along the way, delivering a program such as this really required significant resource commitment on both sides. Competing priorities, emerging developments often posed challenges as we tried to keep the program moving forward. One reality was that our partners in recreation operate on a cost recovery basis. So without external funding such as what was provided for this by our Champlain LHIN, we would not be able to sustain this type of programming. And the reality was when further resources were required from both partners, this could take resources away from other needed activities, and specifically for our recreation partners, needed cost recovery activities. Both partners brought at times very different perspectives and realities, which I think complemented us well, but certainly had to be recognized as we went along. We also faced challenges in recruiting multilingual instructors to meet the needs of our diverse audience. So we were able to provide bilingual programs, but because of the success of this program, we received additional requests for programming in Mandarin, Spanish, and other languages. And one of the greatest challenges, a victim of our own success, was the overwhelming community demand. Mass registration, repeat registrations who came on board, and really the challenge of trying to move our participants onto other existing recreational programming, which was one of our real drivers, was challenging during the first 2 cycles. The other thing that was really evident was the quick turnaround needed for planning, implementation, and learning. This was a living, breathing project that we wanted to quickly apply learnings from cycle to cycle. So often as we were completing the evaluation of cycle 2, we were also in the process of launching cycle 3. The other challenge was meeting the evolving needs of participants. We quickly learned that we were attracting a wide range of participants, so that screening was required, and we need to start looking at repeat participants. In the first 1 and 2 cycles, we had a range of participants from those who were quite frail, even requiring oxygen, to those who reported that they sometimes visited GoodLife on a daily basis for activity. So really defining our target audience and making sure we were doing some screening. So now I'm just going to pass on to the next slide, where we're going to look at this partnership currently to give you a little bit of snapshot of where things are now that we're into our 4th year.
Great. So thanks, Kelly. So as Kelly mentioned, she was very much involved in the first 2 cycles of evaluation of the program. And we thanked her so much for that, because it was very helpful to kind of set us in the right direction and make some changes along the way. But now we're in year 4, and so that's both exciting, and some of the things have changed drastically, and some things have stayed the same. Some of the things that have changed due to the evaluation was looking at ways in which we could more or less standardize the curriculum. As I mentioned earlier, we have certified senior fitness instructors who really are amazing, and they can tailor things as needed. But we wanted to each program to follow a similar flow week to week, and to kind of meet certain key messages related to fall prevention along the way. So key messages were developed and were shared with the instructors with some standardized training. But like I said, the instructors also, we're using that information as needed as well to support the individuals participating. Exercise continuum. So part of being a part of the Champlain Fall Prevention Coalition, really seeing where Better Strength, Better Balance fit as an exercise program for those who are in the community, who are able-bodied, have moderate activity, but also looking at ways in which we can be referring individuals who have high activity levels and sort of being able to lead them in the right directions, as Better Strength, Better Balance is probably not the right fit for them, as well as those who are, as Kelly mentioned, who may be more frail and not able to meet some minimum sort of requirements in screening in. So the opportunity to kind of promote exercise across the continuum of abilities for exercise programming was also something that's happened since the evaluation. The complementary resources that was defined as being needed in the first couple cycles of the evaluation also were able to take place. So some home posters were able to be created, as well as television access to the actual program itself on television through Rogers, as well as on YouTube. And then working collaboratively with our partners as well as ways in which we can, problem solve issues that came along the way, meeting regularly, also with our funders as well, as to little adaptations that might be needed along the way. I wanted to show you, if we go to the next slide, another comment page. And again, these are comments that are sort of ongoing. Part of the evaluation did not change. Every cycle we would do client satisfaction surveys still. And what did not change was the appreciation of a program like this, not only physically, but emotionally as well as mentally, and certainly seeing the link to prevention of falls as well. So next slide. So in spring of 2018, there was some momentum to do a bit of a program review. And as part of the program review, there was different components taken into consideration. The older adults themselves participating. So we wanted to reach out to them, and so we did actually reach out both with focus groups and online as to where they thought things could improve, and some of the examples of where they thought there were some areas for improvement related to registration, and sort of feeling that because public health was taking the lead in that, and that's not something public health typically does, it is something that is not sort of, as we were getting a high demand, let's say 2,000 calls in 90 minutes, it was something that was a bit overwhelming for our system. And for older adults who were trying to register, there was a lot of frustration, understandably, related to that, to be able to have their calls picked up at that time. There was also feedback related to, individuals who wanted to continue to take the program even though they may have taken it multiple times because of their ability, they have identified as not being able to move on to other programming in the community. And so as I said, registration was sort of a key area. The other piece of that we were finding inconsistent was related to the health information and resources that was being available to older adults themselves. So in regards to ways in which that could be improved, some quality improvement initiatives related to registration and the provision of health information and resources were taking place actually this spring. In regards to updating our evidence, literature review was done by one of our master's students that provided us a little bit more insight into fall prevention, specifically related to significant improvements related to fall prevention. And when we first saw the program and sort of developed it, we had in our mind that all programs related to exercise had to be at least 50 hours. And with the updated literature from 2018 really identified that there wasn't really one magic number. Looking at dose was a key piece to that, is really looking at the 3+ hours a week with high challenge balance programming was actually effective, but that could vary from 8 weeks to up to 2 years of programming. So the more of the focus was that it was continuous and making sure that that was available for individuals as well. The literature also reinforced to us what we knew was the adherence, so making sure people are actually attending. And so the literature became very apparent to us as to the importance of taking attendance, because we knew that individuals would have to be attending at least 80% of the fall prevention programming to show a greater risk reduction for falls. And so that was an area that we wanted to also focus in on. So as I said, with some of that new information and the focus on quality improvement, we were able to move to an electronic online waitlist system for the Better Strength, Better Balance participants. Some of the stigma for older adults is that they don't use computers. And I think we were challenged very much in saying, actually, yes, they do. And because about 75% of our BSBB participants actively use email, and that's how they want to receive their information related to Better Strength, Better Balance. We also looked at improving ways in which, like I said, we communicated, where we were able to send out email blasts using listservs. We were able to make our website much more interactive for them to get information in a timely manner. And then obviously seeking ways in which we can reduce costs was also a piece that we were looking at. And it became very apparent that by us not having to mail out health information, not having to mail out registration, we are actually able to decrease some of our programming costs significantly relating to that. But in regards to measuring impact, we still see that as there's some continuous opportunities for that, and I'll speak to that in another slide. Next slide. So seeking means to be sustainable continues to be a challenge. As I said, we were fortunate enough to receive some funding. We still do receive annual funding, and very fortunate for that. But when we were meeting with older adults themselves, we had heard from people who are over the age of 65 that they cannot afford mainstream programming, and that the fitness membership classes were not suitable for their level. So as such, our recreation partners are now piloting a new program. It's actually just launched today, called Just Move, which is very affordable for seniors 65 plus, and is actually at a very similar level to Better Strength, Better Balancing programming. And so that's just launched. So if you have any specific questions for that, I have both Janice Phillips and Leah Champlain who can actually answer some questions related to that as well. So next slide. As for areas of future research, in our article, we really identified some areas that we felt could be looked at for anyone in the academia world, which I see there are some people online today who might want to take on some of this stuff. So looking at the impact of the program on participants' physical activity level, as well as fall risk, and seeing that opportunity both at the 6-month and 1 year post-program, thought that there could be, that would really help to sort of demonstrate the impact of this type of programming. Really understanding more wholesomely the physical, social, and mental health impacts of programs like this. As Kelly mentioned in the early evaluation, it was coming across quite strongly in some of the theming of the qualitative data. But I think there's definitely some additional work that could be done both on the physical component of that and looking more, specifically at the social and mental health impacts as well. And as Kelly had mentioned as well, it would be wonderful to compare this to a control to see if there's any differences between injury and fall rate. From a contextual perspective, one of the things that we've had in our mind, and actually now that we have a pilot of Just Move coming out, we might be able to better understand this, is the influences of free versus fee programming. As Kelly had mentioned in some of the earlier parts of the evaluation, there were attendance adherence issues. And so some of the thought and some of the literature would say is that when people have to pay for something, there's a little bit more accountability to attend versus a free programming. So we're thinking that a study related to that might be of interest to determine. Influences to successful physical activity programs. So what are the sort of both barriers as well as motivators for physical activity programming and might promote or limit physical activity? So we're going to take a pause now, and because we're kind of at the end of our sort of set presentation, and wanted you to have the opportunity to ask us questions or us to answer. And like I said, we have some experts in the room But at the same time, if we don't have answers for you, we can certainly take your information and give you an answer at a later time. So Mariel, I'll pass it back to you.
Yes, thank you so much, Kelly and Darcy. And I just wanted to start it off before we get into some questions, just to congratulate you both as presenters. And thank you so much for taking the time to do this presentation with us and for the community of practice. We have almost nearly 100 people who are logged onto the web meeting platform, and we know that's always more because there are often more than one person per computer that is logged online. And throughout the presentation, we have already 10 questions submitted. So we're going to tackle those first. I'll read them aloud to you, and you can, either Kelly or Darcy, you can feel free to chime in to answer. And for all of the participants, please feel free to continue to submit your questions via the chat box, and Margaret will help us flag them. So the first question is from Helena, and she asks, what is the screening tool you used from Stand Up Falls?
So it's actually been adapted directly from the Stand Up program. So that's a best practice program for fall prevention. So it was, it's called Stand Up. And the screening question, are you wanting to know the actual questions itself, or just it was adapted from that particular program? It is available online if you wanted to. We can put the link up for Stand Up and the screening questions for that, if that's helpful.
Okay, great. I'll give a bit of time in case the participant wants to respond or if they're still online. But thank you for that. We can definitely include the link to the Stand Up program. And so if I see another comment referring to the same question, I will get back to that. We'll move on to the second question. Karen Lavalle is asking if there is a timed up and go test done before and after.
No, not at this time. That is something that it was interesting because we did have a master's student this past spring, and it was put forth as an area that we could examine. But no, not at this time, it's not.
Okay, great, thank you. Another question from Danielle, which you sort of touched on a little bit, but perhaps you'd like to elaborate a little bit more. Are participants allowed to attend a cycle more than once, or can they only go through the program one time?
Hi. When we started this program, to be honest, as it was evolving quite quickly, we were allowing participants to repeat the program. As we went along, and I'll look to Darcy and my colleagues here from Parks and Recreation in terms of the current status. But when we did initiate it, we didn't specifically limit registration. But currently right now, it is still seen as a beginner fall prevention programming. And so it is something that when we are talking to older adults and trying to explain to them that it is seen as someone who hasn't ever taken a program like this before, as an introduction to recreation programming to help them in their ways to prevent falls and overall health, physical and mental. So it is, we have taken people repetitiously, but it is something that we are looking to really focus in on those who have not taken it at all as a priority. And that's been communicated to the older adults in our community as well. This was truly an area where we were a victim of our success. Because many of the participants gelled so well at their sites too, we had situations where groups wanted to register again as a group and be with their friends, and networks had formed. So these were some of the things that we encountered along the way, and definitely now that the messaging has moved in terms of first priority to first-time registrants, we do also have participants who want to come back.
Wonderful, thank you. Shelley Dallas-Smith comments, fantastic work. How did you advertise and market the program? Was there any cost to participants?
So there's no cost to the participants. And in regards to advertisement, various strategies were used, definitely in regards to promoting with our health professionals. And so more recently, actually, we've done more promotion, for example, with physiotherapists, with massage therapists, with other areas as well, too, where somebody who may have recently had a fall may be sort of entering the door. Obviously, in our family health teams throughout the City of Ottawa, for those who have video screens, that kind of thing, there is some promotional material that's available there as well. We've used social media pretty regularly as well. As I said, there's a lot of stigma that older adults do not use social media, which is false. So things like Facebook ads, Weather Network, we've used quite a few different ways to promote. We've done some TV, got some free spots on TV as well. So there's definitely, we also do focus in on our existing recreation guide as well too, with the City of Ottawa Recreation Cultural Facility Services as well too. So multiple different avenues. But more recently, because we are looking for people who maybe have not taken the program before, we are looking at sort of, as I said, physiotherapists, massage therapists, different routes to sort of maybe reach those who may have not taken part before.
When we did do the first evaluation of cycle 1 and 2, we did ask participants how they heard about the program. And in the initial days, this was again an example of how we were able to leverage our partnerships, because both public health and recreation used our channels. But even some of the venues we did promote through in the early days were workplaces as well, through some of our public health nurses in those sites. So, employees might promote it to their loved ones. But as the program progressed too, we started to see increasingly word of mouth. So we felt that was a positive sign, but that increasingly became one way that promotion happened.
Wonderful, thank you. I will just make a comment for all of the participants who are submitting questions. There are quite a few that are coming through, so we likely won't get to everybody's questions over the line today, but I will send them all to Kelly and Darcy, and hopefully they can contact you directly and tackle those questions. The next one is from Brick Homish. I live rurally, and fitness instructors are harder to come by and even harder to have them provide services in kind. What would you suggest about how to fund instructors for their time and commitment?
I'm going to let Janice Phillips, the Manager of Recreation, respond to that question.
So just to clarify, the fitness instructors are paid. Their training is paid, and they are paid for their time to teach. The facilities are given in kind, and full-time staffing resources are all in kind, but the actual instructor is paid.
Perfect, thank you. And if any other participants have comments about that and have other suggestions from their work, please do feel free to insert them in the comment box. Next question is from Eliza Reed. What format did you use for delivery of your fall prevention education?
So in the first 2 cycles, we did try different methods, and that's why we did choose a formative evaluation, because we sort of learned and tweaked as we go. The initial plan was we had public health nurses that would go out to, I believe it was the first session of each program, and they would talk about some of the fall prevention evidence and behaviors and things that they could do. And also, as the program evolved, we also had take-home resources. As the program, from cycle to cycle, and with the engagement of our instructors, a lot of those messages were being delivered by the instructors themselves, embedded within the program and reinforced throughout, as well as online resources were created and the TV component.
Wonderful, thank you. Next question is from Claire Fitzgerald. It would be helpful to know how much of the class time focused on sitting and standing balance, lower body strength, and cardio. Oh, ADLs and cardio, sorry.
So it's Janice speaking from Recreation. The class is set up. It typically follows the standard programming for a fitness class. There's a warm-up session. It usually starts on the chair. There's 3 or 4 options always given. Then they do their cardio is primarily walking. Depending on their mobility, they're given options to try grapevine, sidestepping. And then it really is working with the class. Some will use bands, some will use, they'll use the bean bags on the head. They're very inexpensive equipment pieces. And they work through as a class, but it's not an identical class every time. Our instructors really try to focus on what the group needs, to give the options, and to also keep the variety there, because we don't want them to know exactly what the next move is going to be. There's a little bit of brain training in all this too, and that's what really keeps the interest as well.
Wonderful, thank you. This one's a quick question. Are you aware of anything in Western Canada?
I myself am not aware of anything. I'm looking around the table and nothing that we know of.
Perfect. And as we're running out of time, I will ask just one more question, and then we'll send the rest to our presenters. Kathy is asking, are similar programs available in other areas of Ontario? So I guess that's sort of similar to the previous one that was asked.
Yeah, so the commitment in Ontario, each local health integration network sort of determines key priority areas. So for the Champlain area of Eastern Ontario, the focus definitely falls. Prevention is a key area of focus. So as this has sort of been made available due to that commitment for the extra funds, and obviously, but working collaboratively with your recreation sector at a smaller scale might be something that you start with as a pilot.
Wonderful. Thank you so much again, Kelly and Darcy, and as well, thank you to all of our participants for joining and engaging in such a great discussion. It's wonderful to hear of such innovative partnerships that are forming and all of the unintended consequences that came about with this program. So again, a huge thank you to our presenters. I just want to add, for more information about the fall prevention community of practice, please visit Loop at fallsloop.com. It would be great to keep this discussion going through our Loop platform and our active discussion board. I'm seeing that there are so many questions here, and perhaps participants want to hear more about what's happening in other areas, so that would be a wonderful discussion thread to have going on Loop. And so to close with our webinar, please do not close your window just yet. Wait until you've been redirected to the next screen, where a brief evaluation survey will launch in your browser. We'd always appreciate your feedback so we can continue to offer these high-quality webinars. Thank you all very much, and have a wonderful rest of your day. See you next time.